my practice experience reflection for the critical assignment in HSC593. I had completed the Broad Street internship, which is a 14-week online program. I was specifically on the Wonder track, and my team focused on Lincoln County, West Virginia, and pulled lung and bronchus cancer data from a CDC source. I had utilized data from the CDC Wonder database to develop core data skills. We focused on querying, collecting and entering, cleaning, enhancing, analyzing, visualizing, and then humanizing. I learned to query, clean, and analyze this data, specifically examining the crude mortality rates for lung and bronchus cancer in Lincoln County, West Virginia. I then learned to interpret the trends over time and understood that there were gender disparities in mortality rates. I then developed the ability to connect epidemiological data to real-world factors such as population shifts, behavioral risk, environmental exposure, and healthcare access, which helped improve insight into public health challenges. Throughout this internship, I also had the privilege to apply 5 foundational competencies. For my first evidence-based approach, I had selected appropriate quantitative datasets related to lung and bronchus cancer. I then extracted the relevant incidence and mortality data. I also incorporated qualitative contextual information when needed to better understand the community-level patterns. For my next evidence-based approach, I analyzed the same lung and bronchus cancer data by utilizing a spreadsheet software to organize and calculate the trends. I also reviewed the context to support findings and enhance overall understanding of the data. I then evaluated some existing policies concerning lung and bronchus cancer to determine their impact on public health outcomes and disparities. This included analyzing how policy implementation influenced access to care and equitable health outcomes. My team and I had summarized our data into written reports tailored specifically to public health audiences. We then presented these findings orally to our colleagues to highlight key trends and implications in an accessible way. I then applied known social and behavioral concepts to further understand patterns in lung and bronchus cancer incidence. My team and I then used these frameworks to interpret data and inform potential health promotion and disease prevention strategies. I had faced a few challenges throughout this internship. While working with large public data sets, I found it difficult to navigate compressed CDC data and ensure accuracy while still cleaning and organizing these data sets. I'd also found that data interpretation was not always definitive, as there were multiple contributing factors such as population shifts, behavioral risk, and environmental exposures. As this internship was fully online, I also had to overcome issues like slow internet, software compatibility, and navigating the CDC Wonders web interface. There were definitely multiple lessons learned that are applicable to a public health perspective, such as data analysis and interpretation, identifying health disparities, communicating data effectively, monitoring trends over time, as well as integrating multidimensional factors. In a Christian perspective, utilizing data to identify at-risk populations does align with commitment to serving and protecting vulnerable communities. By allocating resources responsibly, it reflects our principles of wise stewardship of resources and health. And overall, as Christians, we are called to empower our communities and commit to helping others live healthier lives. During this internship, I gained hands-on experience analyzing public health data and learned how to connect complex epidemiological trends to real-world outcomes. I developed valuable skills in data cleaning, analysis, visualization, and interpretation, while also strengthening my teamwork and communication abilities. Most importantly, I learned how data can be used to identify at-risk populations and inform strategies that improve community health, inspiring me to continue pursuing a career focused on using evidence-based approaches to make meaningful impact.